I'm Riley.
I'm Annika.
I'm Vanessa.
I'm Gabriella, and we have Colleen Smith, case study number 1. Colleen Smith is a 26-year-old unmarried secretary. She is being admitted into the hospital with left lower quadrant pain and a history of watery bowel movements containing bright red blood, occurring every 2 to 3 hours for 30 hours. She has a 4-year history of inflammatory bowel disease and has been hospitalized once at the time of diagnosis and is not taking any medication except Metamucil as needed. She lives alone and is in the process of moving from an apartment into a house. Colleen's boyfriend informed the emergency department nurse that Colleen is worried about her finances. She has no income and she is off work. Her insurance covers 70% of hospital expenses and some doctor's bills, but does not cover prescriptions or doctor office visits. Sam is the nurse on the medical unit assigned to do Colleen's admission assessment and develop an individualized plan of care. The ED nurse called the following report: BP 100 to 68, pulse 110, regular, respiratory 18, temperature 104 degrees Fahrenheit. Colleen will be prescribed several medications on her discharge and will be off work for 2 weeks. Alright, so some of Colleen's economic highlights include the fact that she's 26, unmarried, and she has inflammatory bowel disease. She's planning on moving from her apartment to her house, so her illness can limit her finances, and she might not be able to continue her move or provide for herself, however that may be. She's going to need to miss work in order to recover, so if she misses work, she won't have any income, and maybe she could become homeless. Who knows? Her insurance also does not cover the costs, so Colleen may have to pay out of pocket in order to cover all of her expenses, and that would also include her prescriptions. And some extra costs include her hospital expenses, doctor bills, prescriptions, office visits, and one quote that's kind of relevant to her situation: absenteeism from work due to illness is a major and costly problem of U.S. employers. So some of her economic issues can affect her care. So since she'll be missing work, she won't be able to pay for follow-up visits, her medications, or anything else she may need. If she does continue to work, she could jeopardize her health and worsen her condition and end up in the hospital once more. One thought that we sort of had was she's only taking Metamucil and we're kind of assuming it might be because of the cost. Metamucil is a cheaper alternative compared to prescription medications, so that might be a factor, it might not, but that's just one thought. And because Colleen is in the process of moving, she's going from an apartment into a home, so that's a more costly thing affecting her care. And she may want to focus her finances more on her home rather than her health.
So I had the client steps that can include client education and just the steps that the client can take themselves to help with the disease. So the first thing is with inflammatory bowel disease, diet is super important. It can really help alleviate a lot of those symptoms without any medication. So the first aspect of the diet would be fiber. So when it's increased normally, it can cause bloating and gas, but if it's increased slowly, then it can actually help with the decrease constipation. To decrease the bloating and the gas, they would need to incorporate it over about 2 weeks, slowly incorporate it. Some foods that are rich in fiber would be fruits, beans, vegetables, and whole grains. The next would be avoid problem foods. So it's super hard to pinpoint foods that are going to be problems for everyone because everyone is a little bit different. So just the client should know what foods irritate their symptoms and then avoid those foods. Some foods that can be problemsome would be alcohol, chocolate, caffeine, and dairy. And then another step would be just be consistent with your meals. So you want to eat about the same time every day. Don't skip any meals, so that way your bowel is regulating at about the same and it just stays in that pattern. There are 3 more steps that the client can take to manage their symptoms. The first would be increasing fluid intake. So it's important to not only increase fluid intake for the condition itself, but also when you increase fiber, you also need to be increasing your fluid intake, otherwise you can cause constipation. And then also exercise. Exercise actually helps to promote healthy movements in the small intestine, which can help with the disease. And then there's different medications that can be used for irritable bowel disease, and they don't really go to treat the disease, they go to treat the symptoms. So the first one is going to be anti-inflammatory, and these are going to be your aminosalicylates and your corticosteroids. and then also your immune system suppressors, your cyclosporins, and your MABs. And the immune system suppressors work to decrease inflammation, and that's secondary to the immune suppression.
Okay, so I had the patient rationale. The rationale is just the increase of cost that can potentially happen if you don't adhere to your lifestyle changes or treat your disease. So Colleen has inflammatory bowel disease, which can be life-threatening if not treated correctly and managed properly. Uncontrolled inflammatory bowel disease can lead to a perforated colon, increased risk for osteoporosis, inflammation of the skin and eyes, and an increased risk for blood clots. Colleen is at a high risk for developing all of these, which are further complications if she's unwilling to visit the doctor due to her financial issues. An increased risk of further infection will be more costly than taking care of the problem. Okay, so these are just some continued rationales. There are multiple costs that are directly associated with letting an illness develop into something worse. If the issue is not taken care of correctly, Colleen's medical costs can rise in 3 ways. An increased cost in her medical services, an additional and avoidable pharmacy expenses, and any diagnostic testing that had not been taken care of first. And if Colleen agrees to pay the pharmacy expenses and hospital visits, she can treat the illness sooner and avoid any additional costs.
Okay, so as nurses, when conflicts arise due to economic status, we must do what is best for the client, regardless of existing constraints. These are some potential resources that may help in situations like this. Within the institution, there may be a charity policy set up, and they may help with providing free care or a sliding fee scale to those who meet the requirements. Outside the institution, there are also charity services such as safety net providers, including federal qualified health centers, board of health clinics, public hospitals, and private physicians. All of these may be able to help in situations like this. Nursing is more than a career or a means to financial goals. As Christians, we are called to love others, to care for those less fortunate, and to minister to the sick and dying. Identifying potential resources such as the ones listed on the previous slide, as well as client education, are good works that we can do as both nurses and Christians, regardless of economic status.
And these are our references.